We're going to talk about opting out of Medicare, and I'm sure that virtually everyone in this room knows the reasons for opting out of Medicare. I'm sure that many of you have been harassed and abused by the Medicare bureaucracy. I'm a neurologist, and of course I read the neurology journals. The main journal of the American Academy of Neurology is called Neurology. And they published an article last year on physician burnout, where they said the prevalence of burnout is higher in physicians than in other professions and is especially high in neurologists. Physician burnout encompasses three domains. Number one, emotional exhaustion, the loss of interest and enthusiasm for practice. Number two, depersonalization, a poor attitude with cynicism and treating patients as objects. And number three, career dissatisfaction, a diminished sense of personal accomplishment and low self-value. Burnout results in reduced work hours, relocation, depression, and even suicide. Burned out physicians harm patients because they lack empathy and make errors. And so the prevalence of burnout is high among neurologists. It exceeds supposedly 50%, which is horrendous. And again, burned out physicians basically result in a documented higher error rate and poor patient outcomes. So the consequence of being treated by a burned out physician may not be so good. The outcomes may be poor. So what's causing all this physician burnout? Well, increasing bureaucracy is certainly a major contributor to physician burnout. It seems like every day and every month they come out with some other hoop that you're supposed to jump through in order to comply with the regulations and receive payment. And your life has basically been reduced to something like this, where you're running harder and faster, trying to see more patients per hour so as to meet the bills. And it's just not a very good lifestyle. The fact is, Medicare obstructs, impedes, and interferes with nearly every aspect of the practice of medicine today. They have their tentacles all over everything in your office. And the 2,000-pound gorilla is standing and looking over your shoulder, making sure you're not spending too much money on those old folks. So it leads to frustration because you're basically practicing medicine like this or like this. The other thing is that in addition to reducing physician burnout, there was an article in the New York Times just this week entitled, "To be sued less, doctors should consider talking to patients more." And they researched this and found that doctors who talked to their patients more did indeed get sued less. So that, of course, is one of the benefits of opting out and becoming third-party free, is that you don't have to put people through like cattle to make a living. You can actually spend time talking with your patients, and it has the benefit of probably reducing your malpractice claims. There's also, of course, the risk of prosecution, prison, and ruinous fines. As Andy mentioned, there have been physicians who have wrongfully gone to prison because they ran afoul of some Medicare rule or regulation. And don't forget that we have private bounty hunters out there in the Medicare system known as recovery audit contractors, the RACs, who get a percentage of whatever they recover and take back from physicians. And there's also the zone program integrity contractors who are actually looking to hook up physicians with crimes. And that's in addition to, of course, a veritable army of Medicare contractors-owned fraud units and the HHS OIG, Office of Inspector General. So those are some of the negative things, the reasons why you might want to consider opting out of Medicare. There's also a positive that spending more face-to-face time with patients makes for happier patients. And this is only common sense. I'm sure that none of you would like to be treated like a head of cattle and rushed through, given the bum's rush. People actually like to talk to their physician more than 6 to 8 minutes and have a chance to answer questions and have their questions answered. Then we come to the most recent thing, which is the awful, hated SGR. Many medical associations did all they could to lobby to get rid of this horrible, awful, and hated SGR, which never worked, by the way, as far as controlling costs. And boy, they defeated it. Man, we defeated it. You hear them boasting all over the place, but what did they get in return? Well, some of you may remember the Mothra horror series from the 1960s. But what you may not know is that Mothra actually had an offspring named Macra. And Macra was born April 16th, 2015 in Washington, D.C. And he is every bit of a whore as his father. But you'll notice there's a bright light shining down from Macra, and that's shining down on opted-out physicians, as Andy mentioned. If you look at section 106 of Macra, that's where you'll find the permanent opt-out that's available now to physicians. It's the indefinite continuing automatic extension of opt-out election. It's under section 106 of Macra. And if you look, the applicable 2-year periods are still in there, but it automatically renews at the end of every 2-year period unless the physician decides to terminate it. And if you decide to terminate the automatic renewal, you have to notify the various Medicare contractors no later than 30 days before the end of the previous 2-year period. And again, the effective date is 60 days after the date of the enactment of this act, which would put it at June 17th of this year. So again, physicians who submit their opt-out affidavit after June 17th can now permanently opt out of Medicare. It's the permanent divorce we've all been waiting for. So I'm going to talk briefly about some of the factors to consider in making the opt-out decision. There are both financial considerations as well as non-financial considerations. Under the financial considerations, you need to consider looking at the total revenue equation. And that is gross revenue minus expenses equals net revenue. And certainly for the Medicare program, although the CMS bureaucrats will tell you that it's a low administrative cost, they don't include the administrative cost to physicians in their offices to have to comply with all the obtuse regulations and have to appeal claim denials and the like. So once you get rid of that huge administrative expense of dealing with the Medicare bureaucracy, you need not necessarily raise your fees that high to experience an acceptable net revenue. You also need to look at the type of services you provide, the patient population, and make some assessment about the ability to collect directly from your patients. And if you elect to stay in Medicare, you need to consider the other side of the coin, that is the cost of you and your staff keeping up with the ever-changing Medicare rules and regulations, and again, the cost of filing and handling Medicare claims and appeals relative to the revenue generated. Before I opted out in 2004, I was spending approximately 40% of my professional time doing nothing but fighting Medicare, usually over mistakes that they made, and appeals and counteracting the nasty letters they would write to patients, the inflammatory letters they would write to patients. And that took a lot of time. 40% of my professional time was spent doing nothing but fighting with Medicare bureaucrats. I never lost a battle. I was persistent, but it's a high cost to have to waste 40% of your professional time fighting bureaucrats as opposed to treating patients. Also, if you decide to opt out, it may be helpful to find a niche service if possible. And you need to think about how to develop a marketing campaign to inform your patients of the benefits of seeing an opted-out physician. And I will tell you that all of you sitting in this room today already have a niche. And that niche is you can actually spend time talking with your patients. And that's something that a lot of physicians in the Medicare program, either as participating or non-participating physicians, really can't do. So what will happen to physicians who remain in Medicare under this new Macra law? Well, you'll still have price controls. The Independent Payment Advisory Board, which has not yet been appointed, by the way, will implement price controls designed to cut physician fees. You'll also be dealing with alternative payment models, read Obamacare accountable care organizations, such that money will be paid in the future only to these alternative payment models and not to individual physicians. So you're going to see a situation of bundled payments where some accountable care organization gets all the money and then decides what to dole out to the individual physician serfs. And then there's the merit-based incentive program, which will replace the EHR Meaningful Use and Physician Quality Reporting System, the PQRS. And again, you get the picture. They're going to find more and more hoops for you to jump through to qualify for what remains really minimal rewards. So again, individual physicians will be assigned a composite performance score, how fast you run on the wheel and for how long and whatever, and they will post that composite score on some public website as an indicator of quality. So this is kind of a glimpse of what your life is going to be like if you remain in Medicare under MACRA. Also, starting in 2017, CMS will make cuts to what they call misvalued codes, mainly for specialists to meet budget targets. And in 2016, next year, there will be a reduction in CMS and Medicaid service-based fees if you're not enrolled in MOC. So they've got a whole plethora of ways they're going to find to reduce costs under this system. So in addition to the financial considerations, there are also non-financial considerations of opting out of Medicare. First and foremost is the freedom and pleasure of actually practicing medicine again instead of practicing bureaucracy. How many of you went into medicine to practice bureaucracy? Don't see any hands out there. So basically, you need to kick the 2,000-pound gorilla out of your exam room. It doesn't belong there. And happiness basically replaces physician burnout. There's also, as I mentioned, the positive patient experience. And you're also able to protect patient privacy better as an opted-out physician. You don't have to lose sleep at night over possible ruinous fines or prison time for inadvertent coding errors or running afoul of some obtuse Medicare law, rule, regulation. And you don't have to worry about the bounty hunters or Z-pick people tracking you. There's also a simplification that goes along with opting out of Medicare, in that you really don't have to use any codes in serving Medicare patients. There's no claims to file, of course. And again, no more constant Medicare hassles. There's more time to spend interacting with patients and more time to spend with your family. So basically, it's experiencing the joy of practicing medicine again. In making your decision about opting out of Medicare, you should check all of your contracts and hospital bylaws to ensure that there are no conflicts. And if you're unsure, ask an attorney to review your contracts and any other legal documents that may be pertinent. And then there's the nuts and bolts of actually opting out of Medicare. And you do have what's called a toolkit in your packet where it goes through how to opt out of Medicare. It gives you a sample affidavit, which we will be updating shortly to reflect the permanent opt-out status, which will be available after June 17th of this year. There's also a sample private Medicare contract in that packet, as well as a sample letter about notifying your patients about your decision to opt out of Medicare. So the actual procedures are different a little bit for non-participating physicians versus participating physicians. Non-participating physicians can opt out of Medicare anytime during the year. And a copy of the opt-out affidavit must be provided to the Medicare carrier, and it's plural if you deal with more than one Medicare carrier, no later than 10 days after the first contract to which this affidavit applies is entered into. I would highly recommend that you not wait until the 10-day period after you've entered into a contract to submit your affidavit. And the reason I say that is because of the Medicare bungling factor. I mean, the General Accountability Office has found that 96% of the time, Medicare gets it wrong. And so you don't want to be kind of hanging out on a limb, having provided patients under a private having provided services under a private contract, and you don't have the affidavit in place, the Medicare carrier loses it or doesn't process it in a timely fashion, it could lead to problems. So I highly recommend that you provide the affidavit well in advance of the planned start of the opt-out period. And you should know that there's a 90-day grace period after filing the first affidavit, during which the physician may withdraw the opt-out affidavit if it's not working out. And again, be sure to check other contracts and affiliations you may have which may require participation in Medicare. That's the procedure for non-PAR physicians. Participating physicians can opt out only 4 times during the year. And the Medicare contractor must receive the opt-out affidavit 1 month before the beginning of each quarter. So the deadlines that apply for the carrier receiving your opt-out affidavit are March 1st, June 1st, September 1st, and December 1st. And again, the reason for that is the Medicare contractor needs time to change the system so as to flag it that you're not to be paid automatically as a participating physician. Just because you opt out doesn't mean you're completely out of Medicare. Opt-out physicians who provide services in an urgent or emergency situation, you see the patient in the ER, for example, you cannot make a new contract with a Medicare patient in an urgent or emergency situation. If you already have a contract with that patient and you've been following the patient under that private contract, that's a different situation. But you can't make a new private contract in an urgent or emergency situation. So what do you do? Well, an opt-out physician who provides services in an urgent or emergency situation can file a claim with Medicare. And in that circumstance, the opt-out physician is basically treated like a non-PAR physician in Medicare, and the non-PAR allowed amounts and limiting charges apply. If you live in a state that also has a state limiting charge, as I do, in addition to the federal limiting charge, those limiting charges are all applicable. As I mentioned, there is an early termination of the opt-out. Again, the requirements are that you not have previously opted out of Medicare, and you must notify all Medicare carriers that you deal with of the termination of the opt-out no later than 90 days after the effective date of the opt-out. The early termination comes at a cost. The cost is you must refund to each beneficiary with whom practitioner has privately contracted all amounts collected in excess of the Medicare limiting charge, and you must notify all beneficiaries with whom you've entered into a private contract with of the termination of the opt-out and their right to have claims filed on their behalf with Medicare for services provided during the opt-out period. So you can terminate the opt-out early on, but it comes at a fairly significant cost and hassle factor. The physician then, after the early termination, is basically reinstated to his prior Medicare status as if the opt-out had never occurred. And again, the sample affidavits, sample private contracts are available in the toolkit. They're also available on the AAPS website, the step-by-step directions. And you can also find on the AAPS website a list of physicians by state who have opted out, videos of talks given by opt-out physicians about their experience and tips for success, and a list of physicians in various specialties who are willing to serve as mentors and answer specific questions regarding the opt-out experience in their specialty. And a little later this afternoon, we will have a surgeon, an orthopedic surgeon, tell about his experiences in his particular specialty. And of course, AAPS offers these Thrive, Not Just Survive seminars at least a couple of times per year at different locations throughout the country. And we've been doing this for about 13 years now. And I would point out that a tax-deductible donation to our AAPS Educational Foundation can help expand our medical student program. We often provide financial support to have medical students and residents attend meetings so that they can sort of get off to the right foot and not go to the dark side of medicine right when they get out. So here are some of the tips for opting out of Medicare. As I mentioned, start early. Start at least 6 months in advance of beginning the opt-out period. This gives you the time that's needed to inform your patients of the changes, the benefits to the patients of you having opted out of Medicare. It also gives time for you and your staff to adjust. Filing the opt-out affidavit 6 months in advance also gets rid of the Medicare bungling factor. I would highly recommend that when you opt out and you send in your affidavit that you accompany it with a cover letter, certified mail, return receipt to the Medicare carrier, requesting that they acknowledge in writing that the opt-out has been properly accomplished. Otherwise, they may send you nothing. You may not know what they've done with it, if they've lost it, if they processed it, and you're sitting around providing what you thought were privately contracted services with Medicare patients for a couple of years, only to find out that they lost it, they don't have it, and then it's a real problem. Number 3, you also need to make sure that office procedures are in place so that no Medicare claims are filed except on emergency and urgent care basis. And again, if you have any specific questions about opting out of Medicare or transitioning to a third-party free practice, feel free to call AAPS. We're happy to try and answer your questions. And I thank you for your attention. We're going to have a Q&A session right now for about a half an hour, actually. So thank you very much.